Hi, my name is Dr. Christian Hendrix. I'm a second-year resident at St. Louis University Internal Medicine Program, presenting the clinical vignette titled Management of Severe Agitation Secondary to Acute Toxin-Induced Encephalopathy in a Young Healthy Female. I would like to thank Dr. Pollard and Dr. Kamel for their contributions. For this case, the major learning objective is to recognize the potential impact of implementing hydroxyzine as an anxiolytic target in patients with severe agitation. For background information, we can begin with noting that agitation and delirium contribute to $4 billion of healthcare costs and is associated with poor outcomes. Agitation is defined as motor, verbal, possibly aggressive behaviors that fluctuate due to the impact of multiple neurobiological pathways. This makes assessing the etiology of agitation difficult to identify and manage. In the literature, specific etiologies of agitation can be outlined via neurobiological pathways, whether agitated depression, mania, toxin ingestion, psychosis. Furthermore, these pathways are often not exclusive and overlap. In this case, we have a 22-year-old female presenting unresponsive with concern for polysubstance intoxication, vital shield tachycardia and hypotension. Physical exam demonstrated an intubated sedated patient with constricted pupils without clonus. Her blood ethanol was negative. Her expanded urine drug screen showed THC and oxycodone. She demonstrated toxin-induced encephalopathy with severe agitation, RASS score to +4, even after 7 days of anxiolytic management. However, on day 8, hydroxyzine was first initiated with noted significant impact to RASS scores within hours. This is outlined in her hospital course in Figure 1. We see she had a witness seizure, was given midazolam by EMS, was intubated for low GCS, had toxin-induced encephalopathy, neurology was consulted. Her anxiolytic intervention was propofol through GABA inhibition on the CNS, opioid agonist fentanyl, and benzodiazepine. On day 2, her EEG and LP were not clinically contributory. Her intervention was transitioned to dexmedetomidine with alpha-2 agonist effects. On day 3, her ventilation liberation was challenged by severe agitation. She began receiving antipsychotics through quetiapine and haloperidol. On day 6 and 7, psychiatry and toxicology were consulted. She received additional diazepam with benzodiazepine anxiolytic action via inhibition of the locus coeruleus center for norepinephrine production. On the morning of day 8, she received hydroxyzine, and within that morning, her RASS score significantly improved to 0. This allowed her sedation to be weaned the next day, extubated the following day, and she was discharged some days later due to social factors. To discuss this case, we begin with the first step in managing agitation, assessing the etiology prior to pharmacological management. We note multiple neurobiological pathways involved in agitation outlined in Figure 2, the interaction of the prefrontal cortex, amygdala, nucleus accumbens, ventral tegmental area, and locus coeruleus. Hydroxyzine's mechanism of action as an anxiolytic includes its serotonin target for agitation and anticholinergic and histamine inverse agonist properties. Histaminergic fibers emanate from the tuberomammillary nucleus and project through the central nervous system. Current guidelines on the management of agitation, even including ICU guidelines, emergency psychiatry guidelines, focus on sedation, pain control, benzodiazepines, and antipsychotics, but don't mention hydroxyzine. In this patient, multiple anxiolytic targets were utilized due to her opioid tolerance with upregulation of GABA and opioid receptors. Hydroxyzine proved an appropriate anxiolytic choice. In our conclusion, please use Figure 3 for this QR code for an assessment interaction. Now, clinical trials have compared anxiolytic medications such as benzodiazepines to hydroxyzine and shown preference for benzodiazepines, but this has not been done in patients with the same etiology of agitation. Additional research is needed for direct randomized control comparison trials with hydroxyzine to supplement current agitation management guidelines. While benzodiazepines and antipsychotics are often utilized, hydroxyzine also has a role as an anxiolytic option with favorable safety profile, and is well tolerated in patients as was shown in this case. Thank you.